Hello, very good evening, friends, in the session of Materia Medica. And today we're going to learn one of the important remedy from practice point of view, that is the sulfuric acid or acid sulf. This remedy I have used many times in certain specific things, and that approach I will going to share with you. Most important thing for which I have used the acid sulf many times in my practice is aphthous ulcers or recurrent aphthous ulcers associated with gastritis or associated with acid peptic trouble, heartburn. This combination, whenever persists with a debility, with a weakness, I have used this acid sulf many times. Even in young persons who looks debilitated because of recurrent aphthous ulcers associated with severe heartburn, specifically those who are generally a drunkard, this remedy is a wonderful remedy in such types of cases. And it gives very specific result. Hahnemann have mentioned, or Herring has mentioned over there, one important thing that it should be used in diluted form. The tincture should be mixed with water, and then you should give it for the prevention of or stopping the craving for alcohol. But I have not used like that. I have used directly a potentized sulfuric acid, 30 potency or generally 200 potency, few doses depending upon the susceptibility of the person. And I have given this remedy to the patient in order to stop the acidity as well as aphthous ulcers. And this works beautifully. When this combination is there, the alcoholic habit associated with heartburn, associated with recurrent aphthous ulcers, this trinity of symptoms gives you acid sulf. And these persons are exhausted very early, debility happens to be there associated with that. Then you must think about the acid sulf. A second important thing for which I have used it in a case of alcohol withdrawal. The patient who was 35 years of age brought to me having a tremendous withdrawal symptoms. He was in tremor, but externally the tremors were not appearing, but internally he is feeling it tremendously. And he has stopped taking alcohol since 2 3 days, and then he had taken some largactic tablet also, but he thereafter he becomes drowsy, and then he was brought to me. And this fellow used to drink every day earlier, and that somehow someone have told him some matters have happened, and all of a sudden he stopped that taking the alcohol, and he went into the withdrawal. He had very severe heartburn actually for 4 5 days back before that when he consumed alcohol. And then he had a vomiting, then he had severe pain in stomach, and he became exhausted. And then all of a sudden he stopped taking the alcohol and withdrawal, he went into the withdrawal. So this is a debilitated person craving for alcohol with a withdrawal, with internal trembling, and patient is becoming tremendously restless. This condition itself suggests acid sulf. So I used to use, to stop the habit of alcohol, I used to use acid sulf if person is debilitated. I have given him acid sulf 30 few doses along with Quercus mother tincture. Quercus is the remedy I used to use to stop the habit of alcohol. So Quercus mother tincture is a very useful to stop the alcoholic craving, which I have used along with that for that fellow. And within a day, his heartburn was completely under control. His internal trembling has settled. 24 hours after, he was quite fresh. And thereafter, he stopped taking the alcohol. I have repeated often acid sulf 30 infrequently or 200 after some time. Even 1 m I have given him within span of 6 months. But thereafter, forever, he stopped taking alcohol and he becomes completely a different person who was labeled as a drunkard earlier. So this is a wonderful remedy to be utilized in such types of cases where I have used very commonly the acid sulf. There are many more facets for acid sulf. We're going to learn it from Allen's Keynotes. So open your book, Allen's Keynotes, and see what Allen has mentioned. This remedy is proved by our master, Dr. Samuel Hahnemann. Sulfuric acid, it is H2SO4. This is adapted to light-haired persons. So, Constitution is explained in first sentence, the adapted to the light-haired person. Old people, especially the women. So, old people, light-haired persons, women, flushes of heat in climacteric. This is one more indication for the acid sulf, which we generally never think. Many times it happens that lachesis suffices, sanguinary candidiasis is useful, sepia is useful, and we never goes toward the sulfuric acid. But this is one remedy which has been mentioned for specifically for this climacteric complaint. Unwilling to answer questions not from obstinacy but inaptness. What he says? Unwilling to answer the questions not from obstinacy. So when you put a question to the sulfuric acid patient, they are not have an capacity to answer properly to your questions, and that's why they never answer. It is not because of ego, it is not because of obstinacy, but it is because they don't have that specific quality how to answer, and that's why they tries to avoid giving the answers. This is what inaptness. Inaptness means they don't have that specific quality or capacity to answer. Ayogya, kaushalyahin. That is what the meaning of inaptness is there. Feels in a great hurry. That is another feature which goes very close in with the argentum nitricum. So they are always hurried, hurried. Everything must be done very quickly, like argentum nitricum. But argentum nitricum is hurried at all level. His walking is hurry, his eating is hurry, everything is very fast in argentum nitricum. Pain of gradual and slow increasing intensity, which ceases suddenly when at its height, often repeated. So pain which appears gradually, it reach to the peak and then suddenly it stops. This is the quality of the very specific quality of sulfuric acid. There in bracket it was written pulsatilla, but this is opposite to the pulsatilla actually, reverse of pulsatilla. It is wrongly printed over there, but it is reverse of pulsatilla, because in pulsatilla the pains come suddenly, reaches to the top and then gradually reduces. This is exactly opposite to the pulsatilla. So in some books it has been printing was wrong. It is written as a similar to pulsatilla, but no, it is reverse of pulsatilla. Pulsatilla appears suddenly and leaves gradually. That is the characteristic of a pulsatilla pains. The pain is pressure as of a blunt instrument. So pain is like as if there is a pressure from blunt instrument. Tendency to gangrene following the mechanical injury, especially of the old people. Gangrenous tendencies. So going in direction of syphilitic miasm. So you have to understand that debilitated syphilitic personality, this remedy is very important. So gangrenous tendency, specifically after the trauma, after the injuries, mechanical injuries, this is a wonderful remedy. Child has sour odor despite careful washing. It looks like a rheum child, a parcel child, macabre child. So offensive smell from the body of the children is very typical with sulfuric acid. Sensation as if brain was loose in forehead and falling from side to side. This is again a sensation where the brain is feeling loose, going from one side to another side. That is what they feels over there, and characteristic of them appears to be there. Belladonna, bryonia, rustox, spigelia, many more remedies have that typical sensation as if brain was falling from side to side. Next feature, which I have observed in practice many times, apathy of mouth. Generally, what happens? We think about the borax first. After borax, we think of Merksol. But this remedy many times we miss. I have explained the combination. Whenever it is associated with heartburn and indigestion, this remedy is wonderful. Or associated with debility, then it becomes more specific. So apathy of mouth, gums, and entire buccal cavity. The gums bleed readily. Ulcers are painful. Offensive breath from the mouth, like borax. Borax is a very common remedy for aphthous ulcers. Chronic heartburn with sour irritation sets the teeth on edge. So, what the sets the teeth on edge? Like Robinia, it has been mentioned. There are many people who comes to you and they talks in Marathi, that amlet, doctor. That is very typical feature that they explain that there is a teeth which have become so sensitive because of acid or acid secretions in the body, and that's why they says that the teeth are on the edge whenever there is a associated with heartburn. Robinia is very important remedy, but in Robinia it is associated with headache. It is gastric headache, gastralgia associated with headache. Robinia is number one remedy. So gastritis associated with headache, then Robinia. Here gastritis is associated with very specifically the aphthous ulcers or aphthous offensive mouth ulcers. Water drunk causes coldness of stomach unless mixed with alcoholic liquor. So sensation of coldness as soon as patient takes the cold water. Next feature is very, very important. That's what I'm telling you. That is withdrawal symptom generally happens over there. Sensation as if trembling all over without real trembling. Internal trembling is the characteristic, and this generally happens in withdrawal cases. Internal trembling of drunkards. Underline this in your book. This is very, very, very important feature of sulfuric acid. Bad effects from mechanical injuries with bruises, chafing, and living skin, prostration. So see, here it goes close to acetic acid. Bad effects from mechanical injuries. Here it is again goes to the close to the arnica with bruises, chafing, as well as livid skin, prostration. Ecchymosis. Ecchymosis means beneath the skin there is bleeding, hemorrhage. Cicatrices turn blood red or blue are painful. So the old cicatrices means callosities, hardness of the skin. They turns blood red or blue and are painful. If they turn green, then it is a ledampal. When patient talks, doctor, there is a mechanical injury and see that काळा निळा झाला पाय. This is what the term they used to use in Marathi, blue black appearance of the injured side. Sulfuric acid is one of the important remedy. It becomes greenish, then it is the ledampal. But ledampal, the modality is that they feels better by application of ice cold water or ice packs. Petechia. This is again a very important remedy in petechial hemorrhages, purpura hemorrhagica, blue spots, livid red itching blotches. So this is very, very important remedy for petechial hemorrhages. Thrombocytopenic purpura, one must think because if exhaustion is there associated, always sulfuric acid is useful. Hemorrhage of black blood from all the outlets of the body, like Crotellus horridus, like muriatic acid, like nitric acid, terabine, like lachesis. There are many more remedies where black blood comes out. So this is very, very important feature one must consider. Concussion of brain from fall or blow where skin is cold and body is bathed in cold sweat. So head concussion. I have explained one remedy to you. If there are mental symptoms associated with head injury, the natrum sulfuricum, very important remedy. Here, this is one more remedy. Here there is a head concussion, brain concussion associated with coldness all over the body. Patient is going into shock because of pain. Then think about sulfuric acid. Weak and exhausted from some deep-seated dyscrasia. No other symptoms. So patient doesn't have any symptoms, but deep-seated dyscrasia is there. Some deep-seated problem is there, and patient has become completely exhausted, like soranum, like sulfur. This is one remedy one must think. So debilitated sulfur is generally a sulfuric acid, but the proving has not shown so much symptomatology which you can get in sulfur. Relations, the complementary is pulsatilla. In Borix Matremedica, if you open Gibson-Miller's remedy relationship, pulsatilla is complementary as well as antidotal to sulfuric acid. Both tables, this remedy has been mentioned. So sometimes it acts as a complementary to cover the remaining features of the sulfuric acid. At the same time, it removes the certain effects caused because of sulfuric acid. That's why it has been written over there under the antidote. Compare arsenic being a remedy for alcoholism at its features, borax for aphthous ulcers, calendula ledum for even ruta for injuries. They are all injury remedies. Rheum is again for the sour smelling body, especially in children. Symphytum for the bone injuries or contusions. In contusions and lacerations of the soft parts, it vies with calendula. It is very, very close associated with the calendula. But calendula, generally my experience is that to apply calendula locally is wonderful because it produces granulation very easily if you apply calendula mother tincture instead of ointment. Calendula mother tincture removes the local infection very easily, as well as it removes the pus from that area. At the same time, it produces granulation over there. Follows well after arnica with bruised pain, livid skin, and profuse sweat. See what he says, very important word, which we never used to learn that. Follows well after arnica. So after arnica, if arnica is not sufficient, just whenever there is bruised pain, livid skin, profuse sweat, if sweating is associated with pain after a mechanical injury, this remedy is wonderful after arnica. If after injury, if ecchymosis is much more, the ledum, after ledum, you can think about this remedy. Elements from brandy drinking, that's what we have discussed. This remedy is wonderful for alcoholic persons. What is written at the end is very important hint given by Herring. Sulfuric acid, 1 part with 3 parts of alcohol, 10 to 15 drops, 3 times a daily for 3 to 4 weeks has been successfully used to subdue the craving for liquor. This is Herring's experience, but I have not tried it in that way. I have tried it directly in the potentized form and it worked. So this is very, very important remedy in our day-to-day homeopathic practice. Many times, many people ask, is there any remedy to control the craving for alcohol, or if one has to stop the alcohol, what one can do? This is a good remedy to be utilized. So never forget sulfuric acid. It has wide action. It is the remedy which has 30 to 40 days of action as mentioned by Bori, but in some books it has been mentioned as 30 to 60 days of action. So this remedy is a deep acting remedy, but you can, in low potency, you can repeat it in high potency with infrequent doses. You should not repeat in high potency, but in low potency, you can repeat the sulfuric acid. So we have learned very important remedy which is useful in our day-to-day homeopathic practice and useful for many people who have addictions over there. So thank you being there and thanks for your wishes. We'll meet tomorrow again with new remedy from third year syllabus. Thanks a lot.
Thank you very much, sir.
Thank you, sir. Have a good night.
Good night.